I know some of you, or most of you from around the community. Um, the topic of heart disease is, I think, relevant to all people because we all know someone that has some significant heart disease, even if there are no symptoms. So it's difficult for me to give you a PowerPoint and say, these are early signs, these are symptoms you will have, because it's extraordinarily diverse and very physiologically complicated. One person's heart disease is not the next person's heart disease. One person's risk factors are not your risk factors. So when I give examples today and we just talk together, try to keep in mind that the examples I give may not be your example. It may not correlate exactly to your story. But overall, and that's why we have two parts, is that in the end of this dialogue we have together, that I hope we have a dialogue truly where you ask me a question relevant to something that affects your life. But at the end of a complex decision process and discussion, you can figure out where you fit in this realm of risk of cardiac disease, prevention of cardiac disease, how to manage cardiac disease, and just giving you a health plan. The bottom line is most heart disease is preventable, excuse me, if you know. And I have voice changing all the time. I don't know why. I'm in my 40s, but it still happens. So excuse me. Anyway, so I'm going to do a quick kind of review. I thought about a PowerPoint. I thought about all sorts of things, but there's been many PowerPoint comas induced, and I don't want to do that. So I am going to try to just be more thoughtful about it. So what I would like you to start thinking about now is what's the main question that brought you to your seat? And if you may not have one, it may be very global and very broad, but if you want to think about it, even raising your hand in the middle of something that doesn't even seem relevant because you don't want to forget it, tell me and we'll jot it down in our memory and we'll answer it either right then or a little later because I want your specific questions to be answered. One thing about this forum that I appreciate is there's 20 to 40 people to even 50 to 100. It's small enough to meet the need of the individual and not being lost in a crowd. So this is a small group conversation, and the value of that is that you can speak. Now, it's not just me speaking, because your question is most likely very similar to somebody else's. So quickly, and I was thinking about some kind of notes. So instead of a PowerPoint, I wrote down how to kind of keep this organized. And I won't follow this at all, but I wrote it down nonetheless. It's part one, really not because I can start at a part one. It's probably more how do we recognize a problem and how do we get support for what we don't know. So this is more about let's learn some things, beginning of knowledge. We'll call it early knowledge part one. So let's figure it out a little bit. I know that all of you know people with either heart disease, hypertension, heart attacks, coronary artery disease, cholesterol problems, all these things you hear about. So what does that really mean? Some of that has to do with family history. Some of it has to do with even congenital issues. So I will summarize a little bit. Congenital issues some of you may know about. If you have a congenital issue or know of one that has one, know of a person that has one or yourself, that's a unique category. That's a structural or a genetic physical manifestation that is very unique probably to your issue. And that's going to be harder to talk about as a group. So talk to me separately if I don't address that for you. So one is congenital. And oftentimes we deal with that when we're very young. Not always, but often. I'm not talking hereditary things like cholesterol and high blood pressure. I'm talking congenital defects. And that might affect more parents with their child. So if that's you, talk to me, but we're going to kind of go briefly. That's one category of heart disease. Many categories, and they fit together. The most common, however, is hypertension or hypertensive heart disease and how that can progress to heart failure and early death. And cardiac disease is the number one cause of death in our country. And that's a complex statement because it's not the same type of heart disease. So we have to kind of figure out where do you fit in this stratification of risk. Because some of it's reversible, some of it isn't. The other is dovetailed within all this is vessel disease. Whether you have hypercholesterol, you have coronary artery disease, plaques, atherosclerotic disease, some words you might know about, or inflammation of the vessels caused by other diseases like diabetes or some other autoimmune issues. And that can give your vessels a problem. If your vessels have a problem, generally your heart's going to have one at one point or another, and we'll discuss why that is and why high blood pressure is really going to be one of our main discussion points today. Talking a lot now, but it's going to stop pretty soon because I want your questions. The other are, you've probably heard of arrhythmias, where you don't quite beat normally. And all of us feel some of these, especially more towards middle age, women more towards menopause, and you might feel these extra little beats. Well, that's not necessarily a bad thing. Sometimes that's really physiologically normal. Other times it is not. Sometimes those arrhythmias are really a big deal. So when do you kind of say, I'm not sure, and when do you worry, and when do you blow it off? Well, that's a pretty significant thing. So we'll go through arrhythmias a little bit. And again, arrhythmias are linked often to these other things: vessel disease, hypertension, and sometimes genetics, and sometimes structure. So they're all dovetailed in. They can't always isolate one out. The other would be microvascular disease. We talked a little bit about, not the larger vessels, but the real small ones in your kidney, in your brain, in your liver, and all these very small blood vessels are given a lot of attention these days because microvascular, not macrovascular, the big vessels, really can give you some problems with kidney function, renal insufficiency, and we'll talk about those.